Calvin Ridley was carted off today against the Houston Texans with a leg injury. As of right now, sources are coming out saying that Ridley unfortunately has suffered a broken fibula, which is going to end his season. There has been no indication yet as to whether or not this broken fibula is going to require surgery or if there is any other soft tissue involvement with it, but based on the mechanism that we saw his leg and foot go into, there is definitely risk for ligamentous involvement as well. So with today's video, what we're going to start off with is we're going to take a very close look at the injury replay. Then we'll talk about the relevant anatomy and what can potentially be involved with this injury mechanism. And finally, we'll talk about what to expect in the rehab process. Ladies and gentlemen, welcome back. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I try to explain them so that they're a little bit easier to understand. I'll also talk about the pertinent anatomy for that injury as well as the physical therapy process. If you enjoy this sort of content and you would like to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have suffered a broken fibula, go ahead and comment on your experience in the comment section below. So we see here on the injury replay that as Ridley is going to be brought down to the ground, that foot is going to get caught up underneath of him. Here's my model of the foot and ankle. And so the two long bones that are located in the lower leg, the first one and most pertinent one for this injury is that fibula located right in through here. It's on the lateral or outside portion of the lower leg. And as it comes down, it's going to form this area known as the lateral malleolus. The other long bone is the tibia, often called the shin bone, that's going to come down and form the inside portion here known as the medial malleolus. Closer look on the injury replay, we see that as that foot is going to get caught up, he's getting a lot of rotational force going through that lower leg. You can see as I do that on the model here, it greatly wants to try to separate the tibia and fibula bones from each other. If it does this with enough force, it can of course lead to a fracture to either the fibula and or the tibia. Sometimes it can happen to both of them, but for this injury, we know that it is just the fibula. Now let's talk about the potential soft tissue that could be implicated in this injury. As we go through that rotational force going through the lower leg there, when it is trying to separate the bones, it's actually stressing two ligaments that are located directly above the ankle that we refer to as being the high ankle ligaments. The first one is the anterior inferior tibiofibular ligament. And so this one is located in the front and the bottom portion of the leg, and it's named tibiofibular because it is attaching the tibia and fibula together. On the back, we have the posterior inferior tibiofibular ligament. Posterior meaning it's on the back, inferior again lower on the leg, tibiofibular because it is attaching the tibia and fibula bones. There is another soft tissue structure that could be involved in this injury here, and this is known as the deltoid ligament, which is located on the inside or the medial portion of the ankle. So as a person's foot and ankle is going to go into that rotational position, they're also getting some eversion, which is going to affect the inside portion of the ankle and the structures that are located there. So we'll await to see if we get any information regarding soft tissue. This is going to be confirmed through MRI, and that's where we get into our grading system of grades 1 through 3. Grade 1 being the least severe, and finally a grade 3 being a full rupture, of course, the most severe scenario. For the fibula, however, there are a couple scenarios here for this fracture, whether the fracture is either non-displaced or displaced. In a non-displaced fracture, this is where the fibula is broken, but it is in optimal alignment, so surgery is not going to be necessary. If it is displaced, however, this is when the bone is completely out of alignment, and then surgery is going to be necessary to stabilize it. Now let's get into the rehab process for this. So whether or not somebody has surgery, they're going to be in a highly protective phase for at least the first 3 weeks to essentially protect the bone. The person is going to be either in a walking boot or a cast, and they're going to have a limited weight-bearing status. We're going to very gently work on range of motion as well as preserving the strength above the joint, because what can happen here is other parts of the leg can start to atrophy. From 3 to 6 weeks, this is where we're going to progress the person to weight bearing as tolerated in a walking boot. And we want to restore that pain-free ankle range of motion. From 6 weeks on, usually the bone has started to heal enough to where the person can be weight bearing as tolerated without the boot. And this is when we can really start to advance their strengthening. It's going to include calf strengthening, hip and ankle stability, as well as making sure that the person is walking correctly again. 10 to 14 weeks is when we are starting to reintroduce jogging. And so we're going to start this by walk, jog intervals. 14 weeks on, we're getting more into sport-specific movements. So this is going to include cutting and numerous agility drills. The full process is going to take anywhere from at least 4 to 6 months, depending on how the person is going to do with each phase of rehab. If there are no setbacks, usually athletes will make a full recovery from this type of injury, but as you can see, it can be more on the lengthy side. So we'll await any further updates on whether or not Ridley is going to require surgery for the broken fibula and whether or not any of those soft tissue structures are involved, because this can also influence the timeline as well. So unfortunately for Calvin Ridley and the Tennessee Titans, this is going to be more along the lines of a lengthy recovery process, but without any complications, we should see him start the 2026 season. Thank you so much again for tuning in to my video today. If you enjoy this sort of content, I'm going to go ahead and link one of my playlists so that you can watch some of the videos that I've talked about in the past. Thank you so much again for tuning in, and I'll see you next time.